Pharmacogenomics, or PGx testing, is revolutionizing medicated treatment in America. It's taking personalized medicine to a whole new level by helping doctors prescribe medications using their patient-specific genetic structure.
What does a PGx report do for you and your patient? At GENETWORx, we look at your patient's current medication profile. We take the results from your patient's cheek swab and we highlight the medications that the patient is taking where the effectiveness could be altered based on their genetic status.
GENETWORx partner pharmacies share their experiences using PGx testing with their patients.
PGx testing was the perfect tool to add to my toolbox. And that's truly what it is. It's a tool to use with other diagnostic tools to make you as providers more successful in choosing an appropriate drug therapy.
PGx helps eliminate trial and error prescribing. This can save time, money, and potentially lives. Drug therapies for mental health disorders have long been plagued with medication problems. This is where pharmacogenetics can show some of its greatest power.
I've had consults with concerned parents whose children are struggling with ADHD, autism, and they're concerned or scared about starting any medications in their child. Sometimes those children, by the time they get to me, have failed multiple medications. And as a parent, that can be heart-wrenching because what your child thinks they're a failure. They're not a failure. The medicine was not right for them. And so doing a pharmacogenetic test helps provide that starting point and clarity for drug options to help promote success for you as physicians, me as a pharmacist, in recommending the medication that will be the most helpful for that patient.
Millions are hospitalized every year due to medication-related errors. A PGx test uses your own DNA to assist your doctor with prescribing the right medications at the proper dose.
Depending on the medication and the DNA results, you may also see other suggestions such as monitor for adverse effects, consider therapy modification, or alternative drug may be appropriate. If the patient's a normal metabolizer and there's not a drug-gene interaction, we would recommend manufacturer dosing guidelines.
Much like a fingerprint, no two DNA sequences are alike. As such, one person's response to a drug can be completely different from another. It's all about how your body metabolizes a medication. Some absorb slowly, others very quickly, and each scenario can present an adverse event for the patient.
PGx relies upon genetic testing to study genes specifically involved in metabolizing and transporting drugs throughout the body. So in practice, I'm sure there are times when you've had patient A and patient B with similar objective profiles. Maybe they're the same age, same sex, same body type. They both have the same diagnosis, similar symptoms, and you prescribe them both the same medication at the same dose. Because you know that the patient is a rapid metabolizer and we wanted to monitor for efficacy, it can help guide that conversation a little bit more in the direction of making sure that your patient's getting the response that was expected.
GENETWORx is committed to helping doctors prescribe the right medication and ensuring every patient has the drug therapy that works best for their individual genetic makeup. Pharmacogenomics is the future of personalized medicine. To learn more, visit genetworx.com or call 866-932-0109 today.